So joining us today is Dr. Justine Miller, one of our ENT experts, and wanted to talk to Justine today about tonsillitis, because we see a lot of patients that have, recurrent tonsillitis, meaning, they're always on antibiotics. And the indications to remove the tonsils, or a tonsillectomy, has obviously changed over the years. So I just wanted to know currently, what are the indications to get tonsils out?
Okay, so in children, we talk about really two reasons why kids get their tonsils out. One of them is if they're getting recurrent tonsillitis, where they're getting more than 6 episodes of tonsillitis in 1 year.
That's a lot.
Or 4 over 2 years, 4 a year over 2 years, or 3 a year over 3 years. That really, the guidelines say that that's when we take out the tonsils, and often by that stage the parents are so sick of constantly being on antibiotics. That is the time to take them out. The other reason we take out tonsils in children is for sleep apnea, because we know that sleep apnea has a huge impact on kids' ability to concentrate at school, or language acquisition, ability to, they often don't grow, they're often small. There's a lot of things that have long-term implications from having sleep apnea, so it's very important that if children have sleep apnea that they are treated. We know that 90% of children that have sleep apnea are cured with an adenotonsillectomy.
Yeah, that's crazy. We will definitely talk about snoring in kids and obstructive sleep apnea at some stage, because it's a huge area, particularly in paediatric ENT. But just regards to a tonsillectomy, lots of people have tonsillectomies. Can you live without your tonsils? Are they that important?
Yeah, look, tonsils are basically part of the immune system. And so what happens is that when we breathe in or swallow some sort of a bacteria, they respond by reacting to that and then present that bacteria to our immune system. But we have lots of tonsillar tissue. We have lingual tonsils, we have palatine tonsils, we have adenoids, plus we have lots of immune tissue actually just in the back of the throat. So patients can live quite comfortably without their tonsils. It does not impact their ability to fight infection. And actually often with kids or adults that have recurrent tonsillitis, the tonsils are actually causing more problems because they're constantly being infected, and they're actually not performing their role at all, because they get what's called a biofilm living within them, and then every time your immune system goes down a little bit, they flare up again, and it doesn't actually, the function of the tonsils, it no longer becomes functional because they're so scarred, they're so inflamed, they're so infected, they don't work anyway.
Thank you for joining us, Dr. Justine Miller.